Hello, my name is Dr. David Malakov and I am a periodontist, a specialist of the gums and bone. If you're watching this video, then I am here to try and explain to you what deep probing depths actually mean and how they can impact you. Ideally, when we use an instrument to probe around your teeth, we are hoping for the probe to enter between the gum and the tooth at roughly 2 to 3 millimeters. That is what constitutes a healthy environment, one that is able to be cleaned and maintained by you, the patient. The floss that you use to clean between your teeth is only able to reach up to 3 millimeters deep, barely 4 millimeters. When you have probing depths of 5 millimeters or more, then you are unable to effectively clean your gums with brushing or flossing. And thus, the plaque and tartar continues to build up under your gums and over time adheres to your tooth to a point where you are unable to remove it with flossing or brushing. Now, with all this plaque and calculus that is under your gums and attached to your tooth, the body does not want it there, and it causes inflammation, which in turn may cause your gums to be puffy and bleed easily when brushing or flossing. The inflammation that your body causes to try and get rid of the plaque and calculus is unable to do so. And the inflammation is actually what starts to cause you to begin to have bone loss, also known as periodontal disease. The bone is what actually holds your teeth in place. So in addition to the plaque and calculus under your gums, the concentration of periodontal bacteria that you have in your mouth will be one of the determining factors as to how fast your bone loss will progress. The longer you wait, the more damage these periodontal bacteria and inflammation will cause to your oral cavity. When performing a standard deep cleaning known as scaling and root planing, which you may have heard about before or have done before, literature has shown that when patients have 5 millimeters or more probing depths, that the clinician is actually only removing a small percentage of the plaque and calculus out, while leaving a majority of it behind. In addition, a deep cleaning is also done prior to having conventional osseous surgery, where we would actually cut the gum and clean everything out and then sew everything back up via sutures. But thankfully, there is another alternative which you may have heard about before, and that is an FDA-approved laser gum treatment known as LANAP, Laser-Assisted New Attachment Procedure, a minimally invasive approach where we actually do not need to cut the gums or sew anything back up via sutures. Patients typically report less pain and discomfort during and after the procedure compared to traditional periodontal surgery. The LANAP protocol is a patented periodontal treatment cleared by the FDA in 2004. The procedure can only be done with the PerioLace MVP7. This laser operates at a specific wavelength that attacks the bacteria that contributes to gum disease while leaving healthy tissues intact. LANAP is the only gum disease treatment that has been scientifically proven through clinical trials to not only remove diseased tissue, but stimulate and assist the body to regenerate both new bone and gum tissue. Post-surgical recession and tooth sensitivity, which can be significant following traditional gum surgery, is also greatly reduced. I will now show you some videos and animations of what the LANAP machine actually does and how it can vastly improve your periodontal disease and gum issues and help stabilize it. LANAP has been around for many years and has the clinical and research data to prove that it works. So the videos and illustrations that I combined in this video may look old, but the fundamentals and principles still remain the same.
What is LANAP? LANAP is an acronym for Laser-Assisted New Attachment Procedure. LANAP is the no-cut, no-sew laser alternative to flap osseous gum surgery. The procedure is for people who have gum disease, also known as mild, moderate, and severe periodontitis. How do you know if you have gum disease? Some signs of gum disease are bad breath and bleeding when brushing or flossing. For an accurate diagnosis, see a periodontist, gum specialist, who will evaluate the gum and bone support around your teeth by taking a full set of x-rays and 6 measurements per tooth with a periodontal probe. The instrument is placed between your gum and your tooth, and a measurement is taken in millimeters. Healthy gums are 1, 2, and 3 millimeters. Anything greater than 4 is a sign of gum disease. Gum disease is responsible for being the #1 cause of tooth loss in the United States. LANAP has FDA clearance to reverse gum disease. The laser procedure, unlike traditional gum surgery, requires no cutting of the gums. The PerioLace fiber is gently placed between the gum and teeth. This laser fiber selectively removes the diseased tissue inside the pocket and kills the germs that cause gum infection, while leaving healthy tissue unharmed. This also improves access and visibility for better removal of the particles of calculus from the surface of the teeth. Tiny ultrasonic root cleaners vibrate these deposits away and flush them out with antibacterial rinse. Once the surface of the teeth are cleaned, the laser is used a second time at the bottom of the pocket to remove any remaining debris and to sterilize the pocket, soft tissue, root, and bone. This also causes the blood to become sticky, creating a seal around the teeth. Once the seal is formed, we have created a clean, closed, and stable environment for healing to begin. We have tipped the scales in favor of regeneration versus degeneration. Patients who have gone through treatment usually say the day after and a week after that they have about a 2 on a pain scale of 1 to 10.
The periolase fiber, about the size of 3 human hairs, is gently placed between the gum and teeth to remove the diseased tissue inside the pocket. This laser fiber selectively removes the diseased tissue and kills the germs that cause gum infections, while leaving healthy tissue unharmed. This also improves access and visibility for better removal of the barnacles of calculus from the surface of the teeth. Tiny ultrasonic root cleaners vibrate these deposits away and flush them out with antibacterial rinse. Once the surfaces of the teeth are clean, the laser is used a second time at the bottom of the pocket to remove any remaining debris and to sterilize the pocket, soft tissue, root, and bone. This also causes the blood to become sticky, creating a seal around the teeth. Once the seal is formed, we have created a clean, closed, and stable environment for healing to begin. We have tipped the scales in favor of regeneration versus degeneration.